This video is for anyone with Crohn's or ulcerative colitis that's wanting to learn to build tools that work in addition to or on top of standard medical care. My name is Dr. Scott Rauer, and I'm here to tell you about a whole field of research that most people with IBD don't know anything about. And this is partly because medical doctors only have a certain amount of time with their patients, and they can't just squeeze everything in. Also, a lot of medical doctors aren't keeping up to date with the full picture of IBD research just because there's so much, right? One person can't do everything. And when in doubt, gastroenterologists tend to kind of just focus what they've been trained on, which is medications and surgery. So this whole field of research is called psychogastroenterology, or GI psych for short. That's just kind of an easier way of saying it, GI psych. So the best IBD centers in the world, they have psychologists that are part of these medical teams that work with their IBD patients, and they teach them, they help them learn specific tools, specific mind-body tools that can really help with IBD. So I'm going to keep this video pretty short, but just give you a quick sense of what I'm talking about, what this actually means. So let's say you're a patient at one of these IBD centers and you're meeting one of these GI psychologists for the first time. This type of graph, this type of picture would be one of the first things they would bring up. They would say, hey, it's really important that you understand that your brain and your gut, they're highly connected. What happens with one really affects the other. It's a two-way street. The brain helps with digestion, but also the gut can really influence the brain in our mental health. So when one is off, it can really start a whole cycle that can really get out of hand. So that leads to this next type of picture here that is showing this type of cycle. When you have stress, it really can impact you in your IBD and cause a flare. And these flares, of course, cause more stress. And this is something that a lot of people, IBD patients, get intuitively, that stress is a major factor, right? It's the number one reported trigger for flares. And research really supports this. Research really has clarified that stress absolutely triggers flares, but also makes the disease worse over time, and it really can interfere with remission. So if you're not addressing your stress, if you're not addressing depression or anxiety, you could be really missing a key piece of the puzzle, something that could be giving you more control over your disease. So there's a lot more information to learn and share about all of this, but I'm going to keep this video short. If you'd like to learn more, the link will take you to this website that can really be helpful to start to learn all about this psychogastroenterology or GI psych field of research and what it might be able to help you with.